Hello, and thank you for allowing me to provide this evidence. I'm an Australian medical practitioner with 40 years of experience as a clinician, academic and researcher in smoking cessation and tobacco harm reduction. I've never received funding from e-cigarette or tobacco companies. Recently, I was the co-author of a report on the regulation of vaping products in New Zealand and the comparison with Australia. Our two neighbouring countries have very similar culture, demographics and tobacco control laws, but have taken a very different approach to regulating vaping products, and there are important lessons we can learn from the outcomes. Australia takes a very restrictive approach to vaping. Nicotine liquid is legally available as a medicine and is only available with a doctor's prescription and can only be purchased from a pharmacy. Flavours are restricted to tobacco, menthol and mint, and the focus of the regulation is on reducing the risks of vaping and uptake by young people. The regulatory model in practice amounts to prohibition and has been a resounding failure in Australia. 7% of Australian adults vape, and 90% of these have rejected the legal pathway and purchased products from the black market. The black market's controlled by criminal gangs engaged in a turf war to control market share, with regular firebombings of vape shops, extortion and public killings. The vast majority of vape products in circulation are unregulated and untaxed. The black market provides easy access to young people, and Australia has one of the highest youth vaping rates in the world. Increased border control and policing have had very little effect on reducing illicit supply, as they do for other illegal drugs. And the vape industry has effectively closed. In New Zealand, on the other hand, vaping was regulated in 2020 as an adult consumer product. Vapes are sold as consumer products from licensed retail outlets with strict age verification. Regulation is proportionate to risk, reflecting the low risk of vaping. Vapes are available in a wide range of flavours, but disposables and advertising are banned. Vapes are taxed at a flat 20% rate, which is the VAT. In New Zealand, there's no significant black market. The Ministry of Health encourages vaping as a quitting aid and educates the public and health professionals. New Zealand has historically had higher smoking rates than Australia, but as this graph shows, daily smoking has halved over the last 5 years. It's now 6.8% of adults, and smoking has reduced markedly across all ethnic and demographic groups. The decline in smoking during this time has been more than twice as fast as in Australia, which has a daily smoking rate now of 8.3%. In New Zealand, there's no significant black market. Youth vaping increased before regulation in 2020, but it's been falling steadily since then. And importantly, New Zealand is well on the way to reaching its smoke-free target of less than 5% smoking by 2025. So in conclusion, New Zealand has shown that clear, real-world evidence of risk-proportionate regulation of vaping is highly effective in reducing smoking rates at a population level. Importantly, there's been no significant black market, and youth vaping is reducing under this model. Thank you.
Hello, I'm David Sweanor. I'm speaking to you from Ottawa, Canada, where I'm an adjunct professor of law at the University of Ottawa and chair of the advisory committee for the Centre for Health Law Policy and Ethics, among other positions. I was the first lawyer in the world to go to work full-time on instituting policy measures to reduce cigarette smoking. And I've been involved in setting many of the precedents worldwide in reducing cigarette smoking, from tax policy to smoke-free airlines to cigarette advertising bans to package health warnings, whole range of measures. And all of the measures we've looked at, the one that has the greatest potential, and we're seeing it now, is substitution effects, moving people from deadly combustion-based cigarettes to low-risk products that don't require people inhaling the cigarette smoke. We know this is important because we've known for decades that people smoke to get nicotine, but they die because of the inhalation of smoke. And we now have a range of products that could replace cigarettes and give us the potential for one of the greatest public health breakthroughs in human history. We have this ability because consumers want to move, and we're seeing this globally. We've long known that in Sweden, people use a product called snus, an oral tobacco product that's very low risk, and it's resulted in the lowest rates of cigarette smoking anywhere in the European Union. We see very low rates of illness, tobacco-caused illness and death in Sweden because of this. Norway, in adopting this Swedish snus product, saw cigarette sales fall by half in just 10 years. Iceland, with a range of products, the snus, vaping products, and most importantly lately, nicotine pouches, has seen smoking virtually disappear among people middle-aged and younger. Japan, with a heated tobacco product, has seen in just 7 years cigarette sales fall by half. And New Zealand, with an emphasis on vaping products, has seen cigarette smoking decline more rapidly than we've ever seen before. This can be done, even in the United States, which has put impediments in the way of alternatives. In just 5 years, smoke-free products have gone from 20% of the nicotine market to 40%, and cigarette sales are falling at the greatest sustained level the country has ever seen. We can do this. What we need is risk-proportionate regulation. So the more hazardous products have more onerous regulation. They have higher taxation. Consumers are given better information, along with the tax and regulatory policies that encourage them to move to the low-risk products. We're already seeing in Italy great interest in these alternative products. We can facilitate that. We have the ability to use the principles of the Enlightenment, science and reason and humanism, to achieve something really significant. And what can happen in Italy is the same as what's happening in other countries, and we can see much more. We have the ability to get a major public health breakthrough by focusing on substitution. Just like we substituted to get to cleaner water and cleaner air and safer automobiles and safer airplanes and safer buildings, we have done this on so many other issues. We can do it on this one. Thank you very much, and I'd be very happy to do anything that I can facilitate good policy.